that there is not enough money in the world to treat everybody in India for the diseases they have. So this is a starting point. That means that as much currency as we are putting into healthcare, we must do into wellness. If 50% of the disease burden can actually be eliminated if we were to provide 5 elements, and that is clean drinking water, sewage system, garbage disposal, mosquito control, and education, that is school in every village. So at a later point I'll give you, this is between CII and India Healthcare Federation. We have launched this program already with corporates, but it's a very well working model. But I'm saying that as much this we want to spend on that, we should spend on the village level, because that's where the problem really is.
Thank you, sir. I'll speak only about the area I am an expert in, that is medicine. People who are ill want medicine more than anything else. Now, first suggestion, 50 essential medicines can be provided free to every person in India, provided we take 3 or 4 measures that are known to succeed. One in Delhi itself. Pooled procurement, standard treatment guidelines, and reducing the out-of-pocket expenses from 81% as it is today in India, out-of-pocket we are paying, which is the highest in the world, to about 50%. With these 3 interventions, there is no doubt that 50 essential medicines to take care of 90% of the common diseases can be provided free to every Indian. That is one suggestion. Can be done, we have shown it can be done, other people have shown that it can be done. And not by putting in any extra money, but by just changes in management. It's one possibility.
You alluded to the block level or a district level, and then comes the tertiary level. So that's the middle part is the secondary healthcare at the block level. And it's like a hub and spoke method. Now, point being that there are 2 paradoxes here. One is a central issue, the other is a state issue. So states will perform unevenly because of their own priorities of the governments that are in position there. So what we need to do is to, one, try to make the already existing infrastructure perform better. Because like I said, if you start afresh and start making new plans, it's never going to, it's not enough money, it's not going to happen. So we have an infrastructure on the ground which we should weigh. The government's responsibility should be that how to make that structure function better. And it has been suggested, because of panchayats or NGOs working in different levels, that there should be some sort of infusion of monitoring or enthusiasm into that structure to say that the villager has access to just basic care available at his doorstep. Now the ASHA scheme, which is part of the National Rural Health Scheme, is a good in that direction, provided it works. Provided there are actually ASHAs on the ground and there is not absenteeism, money being siphoned off on the ground. So that means that there has to be a regulatory mechanism or enforcement mechanism that the scheme works at that level. Second thing is that we have repeatedly heard around the table there are not enough doctors. And there is no doctor who is willing to go live in a village of 2,500 or 5,000 people where there is no school or college or any facilities, entertainment facilities for his family. But he is willing to live at the district headquarters, where we have secondary care hospitals, we have district hospitals which are not functioning 100%, but they are there. So we, with a public-private partnership, make it happen that district hospitals can become the model of public-private partnership and let mobile systems be based in district hospitals so that a doctor and his team can go on a mobile system in a 100-200 kilometer radius and cover the villages on a daily or every other day basis and provide an emergency system there that in case somebody has a dire illness, there is a number they can dial on the cell phone and an ambulance can be brought to the district hospital. So I think that can, if we systematically work on it, we already have a huge network on the ground which is not working. So it is national waste, let us put together. You need to include private providers into this effort, sir, otherwise it will never happen. So, but we have all tried this public-private partnership and there are some obstacles or the other thrown, and the two are, which are in my belief, and I am on the National Family Healthcare Council or whatever it is called, then we brought it up there. That the block comes the moment something is done on the ground and the official is afraid that the credit may go to the private person, not him, because his job will be in jeopardy. Second is that the moment you ask him to open his accounts or say where are the medicines, where is this, there is an immediate resistance. So we need to break that barrier somehow to make this move forward. Whether it is, there is a very good model we created with the Chhattisgarh government in Raipur, where when I was still running escorts, the government built the infrastructure and we ran it for the government free. And we had done thousands of angiographies, thousands of operations over the last 10 years that it was working, and saved the state government huge sums of money by just investing 13 crores in one time, providing the infrastructure. So there are many models that can be made to work. And the compliment goes, the government changed from Congress to BJP, and the new chief minister came on board immediately and continued that effort. So there was no trying to undo somebody else's work, which was very good. So I'm saying that there is that infrastructure can be leveraged. Now then comes the tertiary care. Tertiary care becomes a problem for the government for two reasons. One, the initial investment required to create that infrastructure is huge. Second is that today, no matter what we do, the salaries of doctors working in tertiary care hospitals are huge. They are making very good money for services they are providing. Now that cannot be accommodated in the government's pay scales. So you will see that again and again the government loses very good people to private sector. So why not reinforce the private sector? Make it feasible for them to deliver that care at a high level but at an affordable cost. So the government and private sector can be in partnership to how to lower their costs so that they can deliver this service to everybody across the board at a lower cost when needed. So I think that if we structurally go through these three segments, there is a real opportunity for partnership between the government and the non-governmental organizations, which are the voluntary sector, and the private sector providers of healthcare. I think it can work, and we can make a big difference if we take care of those four things. Prevention, that is in the village program, at every village must have clean drinking water, must have a sewage system, must have a garbage disposal system, must control the mosquitoes because malaria, typhoid is rampant. And then we must have a school because the young people will educate their parents into hygiene.